So, hello everyone. So I have started this rare cases in an ICU as one of the venture just to discuss various rare cases in an ICU. Since the evidence is very much less for this kind of rare cases, we can have a mutual discussion. We can learn from each other to get our patients benefited from each other's knowledge. So this is the first case which I am going to discuss. It was a full-term vaginal delivery. This baby required resuscitation in form of bag and mask and then bag and tube outside the hospital in view of a mother being suffered from obstetric labor and she was having preeclampsia. This baby received treatment for perinatal asphyxias in form of an ICU care, which required treatment with IV fluids, antibiotics, as well as oxygen. So there was a clinical improvement in the child conditions, and by 3 to 5 days, the baby improved and subsequently was on oral feeds. Since the baby received oral feed by day 3, day 5, we can assume that perinatal asphyxia might be mild to moderate. Now, on day 10 of life, this baby developed multiple reddish nodal non-tender fluctuant swelling over the back in the right infrascapular area. They were indurated also on the infrascapular area. Just to show what kind of rash it is, the rash were like this, which is shown in the picture. Now, excisional biopsy from one of the swelling was done, which show unhealthy granulation tissues along with the fat deposits in crystalline form, which suggestive of on microscope suggestive of both acute and chronic inflammatory pathologies, suggesting of a subcutaneous fat necrosis of newborn. So this is a rare case scenario in which a baby who suffered from perinatal asphyxias and they do have hypothermia during the resuscitation. Now this is the consequence of all this thing, and the baby was followed up and was discharged since there were no other symptoms apart from this over the rash. Within 1 month, this rash disappeared. However, there was a resurgence of the similar kind of rash after 15 days. This also rash disappeared subsequently and baby was normal. So this was a simple case of a subcutaneous fat necrosis of a newborn. Now, to move further, I will be discussing what are the different scenarios which I have came across the infants who was suffered with the subcutaneous fat necrosis. Mostly it is a benign condition, and what we can say it is common in mostly in term or late preterm babies, because that fat necrosis, the term suggests that fat necrosis, for that fat should be there in the body, and term babies they do have fat in the more quantity of fat as compared to preterm babies. And as in this case, which I have presented, it was baby was having undulating course, means the complete resolution took around months. Now this nodules sometimes they behave very notoriously. They can form hypercalcemia because of that granules secreting PTH, that is parathyroid hormone. They can also present with thrombocytopenia as well as hypertriglyceridemias. This is all immunological reactions. Now, this hypercalcemia can turn out to be symptomatic, which can lead to polyuria, weight loss, and the baby might be, because of irritability, because of hypercalcemia, can suffer from feeding issues. So you can assume that term babies having delivery at the remote outplace of from the tertiary center, if they have suffered some kind of birth asphyxias or perinatal asphyxia, which may be mild to moderate, and they can present to you either with hypercalcemia, I mean to say with the irritabilities, feeding issues. So it is very important to check calcium level in this kind of babies. If you get hypercalcemias with such kind of rash, it is mostly because of subcutaneous fat necrosis manifesting because with the nodules. Now, if there is hypercalcemia, treatment required is giving extra amount of fluid. However, if hypercalcemia is recurrent, means if it is causing very severe symptoms, it is not getting resolved with the with the increased fluid requirements, then there is a role of IV glucocorticoids. After starting glucocorticoids, it takes around 2 to 3 days, and mostly generally we use hydrocortisone in such kind of scenarios. So this was a common scenario which I have presented. It is a short discussion. Any of you, if you might be having different case scenarios which with a similar presentation, manifesting in different way or a different levels of severity, we can discuss on this. Thank you.